We're located in Lewis Center, Ohio, and we specialize in hormone replacement therapy, wellness, peptides, and sexual dysfunction treatments. And we also do some aesthetics and other types of treatments for skincare, things like that. GAINSWave is basically extracorporeal shockwave therapy. It's sound waves, and it has a mechanical and a chemical response in the body. The mechanical response is where the sound wave breaks up microplaque that forms in the arteries that feed blood into the penis. The chemical side of it is where it causes neogenesis, where it basically would get new blood vessels to reform and actually help to transport new blood into the penis and help with the erections. Any patient that starts to have erectile dysfunction problems. We have some gentlemen that come in their 20s, all the way up into their 80s. So some guys that are experiencing it a little bit more mildly. The extracorporeal shockwave therapy can help make their erections firmer. Maybe they're not quite experiencing severe erectile dysfunction, but they may be starting to get some plaque building up in the arteries, and it's starting to block some of the blood flow and actually causes the erections not to be as firm. So we have some guys in their 20s coming in for that type of treatment. Then we have men coming in that are in their 70s and 80s that or maybe even their 50s and 60s that are experiencing erectile dysfunction that's actually causing problems in their relationships. And so we have to do a little bit more longer treatment plan for that particular person. But any men that are experiencing erectile dysfunction at some stage will benefit from this procedure. There's really no side effects. It's just sound waves. There's no laser. There's no radiation. Basically, it's sound waves that penetrates through the tissue and just breaks up the microplaque and causes dormant stem cells to release and causes that neogenesis and starts to get the vessels to start regrowing again and to allow better blood flow into the tissue. So sound waves really doesn't cause any type of side effect. We have a lot of studies that have been done. Dr. Richard Gaines did a lot of studies, and they've done studies in Europe, a lot of studies in Europe, and 85% of the men that come through our clinic normally experience good results. Depending on the severity and where they're at, we have to gauge their treatment plan accordingly. But some of the men that don't have to do as many treatments, they'll start to get good results earlier. And then some men have to do a little bit more of the treatment to get to a stage to where the erectile dysfunction is being treated. But I would say probably about 85% of the men get good experience, good results. It depends on the severity. We sit down in a consultation, try to understand what's causing the erectile dysfunction and at what level they're in and how long have they been experiencing it. Do they have any medications that's causing the erectile dysfunction? Do they have any type of physical ailments that are causing the erectile dysfunction? Then after we have that consultation, I educate them on why it works, how it works, and then I come up with a certain plan particular to that person based upon a lot of their answers that they give me on some of the questions about their different issues that are causing it. So it depends. Some just need more treatments. Some can get away with less. Yeah, we normally recommend if it's just like anything else, like an oil change, right? In a car, every 3 or 4 months, you need to get your oil changed. We recommend at least every 4 months to get a maintenance GAINSWave because unfortunately, once we get the plaque removed, life goes on and your plaque starts to rebuild in those arteries. So normally when a gentleman comes in once every 3 or 4 months, we can stop that plaque from getting back into the arteries again and reforming. So normally about every 3 or 4 months, they should come in for a maintenance. Fortunately, the plaque will continue to accumulate. And a lot of times when the plaque starts to block the blood flow, it also stops the growth factors in the blood from getting to the tissue on the other side of where it's being blocked. And when that happens, the vessels start to break down, and they're not getting fed the growth factors and the stem cells that they're normally used to getting. So erectile dysfunction will get worse. So the plaque will start the process of erectile dysfunction, but as it continues to form and it stops and it keeps restricting the blood from getting into the vessels, then the vessels start to break down. So then the erectile dysfunction gets a lot worse. So delaying a treatment plan for this is going to make it harder for you to overcome down the road, and probably have to do a longer treatment plan. But if you get on it, probably within the first year, and make sure that you get in and get that plaque removed and allow that blood flow into the tissue, you should be able to have a pretty good response.